Hi, I'm Mayor Frank Jackson. I'm announcing today the reopening of our Neighborhood Resource Family Recreation Centers. As you know, the pandemic is still with us. And as a matter of fact, the highest number of new cases in terms of infection is with young people. So as we open the rec centers, we're going to have specific requirements as to how to access the rec centers and how to do whatever you come to do in the rec centers. So we'll have some young people talk to you about that. But remember, the pandemic is still with us and that there are rules that have to be followed in order for us to make sure that you can access and use the rec center in a safe manner. Thank you.
Hello, my name is HASHEEN Priest. I attend Villa Angela St. Joseph High School. I currently work for COLLINWOOD Recreation Center. If you are experiencing any signs or symptoms of the coronavirus, please contact a doctor and stay home. All guests are required to bring a mask and wear a mask during all activities except for basketball, swimming, and baseball. You are required to bring your own mask also.
Hi, I'm Morgan Perciato. I currently attend Holy Name High School and I work at Estabrook Rec Center. While visiting your local rec centers, make sure you wash your hands with soap and water for at least 20 seconds. If the soap and water is not available, please use the hand sanitizer stations provided in your local rec centers.
Hi, my name is MALIA Harris, and I go to John Hay High School and I work at ZELMA George Rec Center. To enter the rec centers, you must abide by the 6 feet rule, and that includes high five and other close contact. To enter the rec centers, you must have a program and are not allowed into the rec centers if you do not have a program. You are allowed into the rec centers 15 minutes before your program starts.
Pools will be open, but the number of people will be limited. The pool will now be on a first-come, first-served basis. Locker rooms will only be available to guests using the indoor pools, although showers will not be provided. Pools are open Monday through Friday for the youth 11 a.m. to 5 p.m. For the adults, it will be 5:30 to 7:30 p.m.
Guests will no longer be using the Peak system to sign in. From now on, the staff at the front desk will check you in. The rec centers are open Monday through Friday, 11:30 to 8 p.m., and they're closed on Saturdays.
So as you just heard, we are implementing these requirements, and again, they're designed to ensure your safety and the safety of the staff at our neighborhood resource recreation centers. So again, welcome back, but make sure you follow the rules. Thank you.
Welcome to Age-Friendly Cleveland. My name is Mary McNamara, and I'm the director of the Cleveland Department of Aging. Across our country, we have what we call an aging network of services because no one division of government, agency, hospital system, or faith-based group provides all the services an older adult might need to age successfully. As examples, some older adults may need transportation or in-home health care, modifications to the home, or resources for staying engaged after retirement. It is our hope with this Age-Friendly Cleveland series that you might learn more about the resources right here in Cleveland. This next segment is about one of the trusted agencies we work closely with every day to make Cleveland an age-friendly city.
Hello, my name is Mary McNamara and I'm the Director of Aging for the City of Cleveland.
And I'm delighted to be here with my colleague Meryl Gordon, the Director of Health, for a special segment of Age-Friendly Cleveland and Healthy Cleveland as we talk about COVID. So Meryl, thanks for joining us today. And I really want to talk about COVID as it impacts older adults.
Sure.
Right? There's 70,000 older adults in the city of Cleveland, many other adults with compromised immune systems, adults with disabilities. But I think we need to do a little bit of understanding of what COVID is. So what is COVID? It's also called coronavirus. Sometimes we hear the word 19, so what's an overview of it?
Sure. Well, thank you, Mary. Thank you for having me here. It's very exciting to be on this program with you. So coronavirus are essentially a class of viruses that are generally in animals. They don't often survive in a human host, and so that ends up, when it does come into a human host, it's very difficult to sort of predict its path of infection and how and who's going to be impacted the most. So this particular virus, the reason why it has so many names is that it has sort of evolved over time. So it is a coronavirus, and there are many coronaviruses out there.
Okay.
And SARS and MERS, if you remember those were coronaviruses. This one, we call it COVID as well. It's sort of a algorithm of a number of different words together. So CO for the COVID part is for coronavirus. The VI in COVID is for the virus, and D stands for disease. And 19 is because it was actually discovered in 2019, and that's when it all sort of came to being. So that's why that number is. Often people have asked, is this the 19th COVID that's been discovered? It's not. It's actually based on the year. So it's a respiratory disease. So as we've all learned, and why masks are so important, is that it comes from the droplets that come out of your mouth. I often say, if you fog up your glasses when you go to clean them, that moisture, those droplets, is where this virus can thrive. If you sneeze, if you cough, as you talk, those droplets can come out of your mouth. And so that's really how this virus has been passed from person to person. And as science continues to, and scientists continue to study this particular virus and its spread throughout the community, and how this pathogen really impacts people in the human host, because again, we've never had this before. There's no cure for it. They're trying to sort of understand the entirety of its lifespan, and how some people get so much sicker than others, and as we'll talk about a little bit later, why it has had such a devastating impact on older adults. All this is being kind of studied by people around this globe to really help us with making sure we can manage how much this has infected our communities.
And your role as the director of the Cleveland Department of Public Health, if you could tell us more as the viewers, what's your responsibility during this pandemic?
Sure. Well, we feel like we're ground zero for a lot of it. There is authority that we have in the Ohio Revised Code and the Ohio Administrative Code that we are required to contain and mitigate communicable diseases. Okay. So all health departments are required to do that. We enforce what is also in the Ohio Revised Code, that it's actually illegal to knowingly spread a contagious disease. So that is our work. What we do is we are, once somebody is tested positive, it gets put into the state's disease registry system. We then pull all those names off all day, every day, and begin the process of contacting them. We do this by phone. We've gone to some people's homes where we have not had a phone number, but majority of it is by phone. We contact them. We issue isolation orders for individuals who are ill, who have actually tested positive. We learn about who else they might have been around while they were symptomatic, if they were at work, if they had gone somewhere, if they were at a family event, what have you. They provide us those names of those individuals. We contact them as well and conduct a risk assessment to determine if they need to be issued quarantine orders so that they also stay home in case they were infected. Our job also includes providing guidance to just about everyone. The governor and everyone says, call your local health department, and they do. They find us, and we spend an inordinate amount of time helping people around infection control and what they can do to make sure people are safe. And then one other thing that we do a lot of is we triage where there are outbreaks. So this can be at a long-term care facility, it can be at a restaurant, it can be at a work facility, etc. So our job is to, again, manage and maintain and minimize the spread of this infectious disease.
Really helpful. It's a great team you have at the Department of Health, and the Department of Aging works with you every day on different areas. So that's why it's important, I think, for both of us to be able to share this information. Meryl, what are the most important steps each viewer out there should take to prevent getting the coronavirus?
So, Mary, our best advice is to stay home unless it is utterly necessary to go out. It's challenging, but staying home, staying away from other people physically in their space. As you notice here, we are 6 feet away.
Let's hold this up for viewers.
Measured.
This is what 6 feet looks like.
Tickets, right. It's one way to represent what 6 feet look like.
And I got to share, I often realize that I'm standing 4 feet away from people. I think it's 6, and so visuals can really help do that. And so when you can't be 6 feet away from people, what should you be doing?
So there are things that we also advise. So masks. Masks are right now mandatory in the city of Cleveland and in Cuyahoga County. Wearing a mask is the best way of me protecting you from me. Masks where everybody is wearing them, you also understand and respect each other's space and realize that you are also contributing towards making sure people are safe and providing a safe environment and minimizing the risk should you have come in contact with somebody, should you be asymptomatic, should you not know that you have perhaps come in contact or at risk. But it is the best way to protect the community.
So let's talk about those for a moment then. So we also call them facial coverings, right? Because a scarf would be okay.
Right, a bandana.
Something homemade, a bandana. So I brought a few here that we want to highlight for viewers. I think probably most common we see disposable ones. So these are really a one-time use.
So these are also considered surgical masks, and they're disposable and perfectly acceptable mask or facial covering. What I like about these is that the top of the mask, you could sort of think they're one way or the other. The top has this little metal strip in that's probably about 2 or 3 inches long. And we suggest the way to put it on is you never want to touch the inside with your hands.
Okay.
Hand washing, we'll get into that too, is a critical piece to minimizing the transmission of any disease. So you want to lay the mask in your hand so you're never touching the inside that's going to be on your face.
Okay.
And then you want to sort of put it up to your face.
Okay.
And the first thing you want to make sure you do then is to take that metal part and frame it along your nose and cheek so that it then can actually lay on there.
Okay.
So that you can then take the ear lobes and put them behind your ear.
Okay.
This, because most moisture sort of falls with gravity, you want to make sure that this covers and is against your skin, your nose and your cheeks, almost a seal, so that there isn't air that can, or any of the droplets that can come into that mask. And this is the proper way to wear this kind of a mask. It is a one-time, often I look at the inside to see, I make sure that I close it up if I'm going to be going into my car perhaps and not being around someone, but I'm going to use it again that day. And then I just wear it around my elbow so it's with me. I
saw you come in with that today.
I fold it in half so that, again, nothing on the inside that's going to go against my face gets touched.
Okay.
And then when I'm about to go back into a place where it's around other public people, I then again, I'll open it up. I don't touch the inside. I press it against my nose and cheek, and then I put the ear loops around.
So what I'm really hearing is this idea of covering your nose and your mouth and keeping it as sanitary as possible with the multiple hand touchings that come with it. I think one of the other things I like about this, that when we tell people about these masks, is this could, I know one of the hard parts about wearing a mask is if you wear glasses like I do, your glasses get fogged up. And so it's a way to maybe reduce some of the heat that comes out of it. There's all sorts of masks out there. So this is the surgical, disposable. We at the Department of Aging have been gifted many masks as the health department, and we've been trying to get these out into the community. And so if you're a viewer out there and need a mask, I want to invite you to call the Department of Aging at 664-2833, and we can get you what we call a washable mask. So there's all sorts of those. I have one that my sister-in-law made for me. I have one I got at a local dry cleaners that was selling them. What's unique about these two is they have the same earpieces as this one, but they can be worn multiple times, and they also have an opening. So tell us more about that, what a purpose of an opening in a mask.
Sure. So often the cloth masks can be rather thin. So the opportunity to put in an additional filter inside of the cloth is why these openings are available on some masks. And so this is something that with the fabric-based ones, they can be a little bit more difficult to breathe through, but the reason for the opening is, again, sometimes people will put this mask inside, the surgical mask inside, because these are designed for medical use. And so they have fabric in it that really is designed so that the particles stay, your moisture, because that's what it's saving you from, is certainly not being transmitted through the mask. I think the other thing, Marion, as we go through this, that we cannot underscore enough is that the mask must be worn over the nose and mouth. And so while it is difficult, and we recognize how difficult it can be to breathe with them on, or to have the heat from your mouth and your nose breathing through it, to have it only over your mouth is not, you can all breathe in those moisture droplets through your nose, and if it's in that space, it can get, that virus gets transmitted up through your nose as well.
So really important it's not effective, is what I'm hearing, if you're only covering.
Right.
There are a couple of groups of people that shouldn't wear masks, though. Am I correct? So I know very young children, people who are on oxygen.
Right, and there are some people who it's just not feasible to wear a mask. There are some folks in the developmental disabled community. I've heard from a number of parents of children and adults who are autistic who just cannot wear a mask. And so we recognize that. What that means then is to take then even more additional precautions to make sure that you're not in a situation where they can be put at risk. If they can't, then they really should not be going to the grocery store, going to public spaces. Stay home.
This is that stay at home.
Just stay home, yes.
Before we get to hand washing and sanitizer, I just want to highlight this mask, because this has become pretty common, and I see people, this is one where it has strings, so you can, if you have the ability to tie it around your head, but that can be difficult for some people. So creating sort of ready-made ear loops is another way we advise people to, because we want to make it as easy as possible for people to put on a mask.
Right, right. Yeah, I do that with the one I have. I just tie them, do a double knot so that I can just slip it over my ears. But I'm very, very, again, conscientious that it covers my nostrils and my mouth. So it's not a headband, it's not a necklace. The more you fuss around with the mask and you move it around your face, the more you're putting yourself at risk of contaminating the inside of this mask. So that's why when I take it off, I immediately fold it in half, and for me, I just put it around my arm. But if you put it up on your head, or again down by your neck, you're possibly exposing yourself in a way you're not even aware, because it could possibly be that virus could be landed on your skin. It hasn't penetrated, hasn't gone in your mouth or nose, but it may have touched that, and then you put this back on your mouth, and then you're breathing it in and putting yourself at further risk.
Really good advice on how to keep it clean, which at the Department of Aging, we have been distributing information from CDC about the importance of washing them, right? And if you have the ability this washable mask, to put it in the washing machine and fully dry it, right? Using soap. For some, it's not possible, and using a diluted bleach mixture. And so if you need that information, it's on the Department of Aging's website. You can also call us. We'll mail out both the cleaning instructions and how to wear. It's a really common question we get at the department is, this is all new for us, right? And it's gonna be around for a while, and we wanna make sure that we're staying safe. So a couple of other important steps I know in the Department of Aging we're talking about is the importance of hand washing and using sanitizer in between when you can't fully hand wash it. Is there anything you wanna add to that for the importance of it?
Sure. I think the one thing I say a lot, and we all try to say a lot, is that the virus, because it's a respiratory disease, it penetrates through, again, your mouth and your nose. You breathe it in, right? And then it gets into your person, into your lungs. It doesn't come in through your skin.
Okay.
But the reason why you need to wash your hands is that you never know what you've touched that might have that virus on it. You touch things all the time, just like we've become much more conscientious of what we touch. And then that virus could, just as simple as somebody who might rub their nose, or maybe pick their tooth because there might be some parsley in it or something, right? And so what's on your fingers from touching something where that virus cell might have landed, or somebody else who may have has touched previously, is that hand to mouth, hand to nose action. Again, rubbing your nose and then putting your mask on, you've created an environment where then that virus could thrive and enter your person. So you need to wash your hands often. The best hygiene possible is to wash your hands with soap and water. The best, bar none. And we say for 20 seconds. It's the entire process for 20 seconds, making sure that you are rubbing your hands with the soap all around, in your fingernails, between your fingers, and just making sure that you see, a lot of these are foam soap, so you can really see that you've gotten to everything. And you do this for a bit. It's not just and you're done. And then make sure that everything is rinsed off and that you dry your hands well. And then be conscious again of what you've touched. If you go to open a door, I often bring with me, I'm always kind of carrying, and I have one here. It's a little bit used, but I always have paper towel with me. I cut up paper towels and I carry them with me. because I don't want to touch that door handle with my hands. I will use that paper towel, I'll open the door handle, and then I'll dispose of that paper towel. And that just helps to make sure that in between times when I wash my hands, I've minimized that threat that I have picked up that virus, or any other virus, mind you, right, or any other bacteria on a surface. If you don't have that option, and you do open a door, or you do touch an elevator button or what have you, then it is important to have some hand sanitizer available. It's good, it's advisable, but nothing at all beats hand washing with soap and water. I just wanted, because I mentioned elevators, just thought I would put a plug here. My mother lives on the 13th floor of a building, and we've talked through this many, many times about the elevator. And she has every right to say to somebody, please don't enter the elevator, right? Because it's very important to minimize how many people are in that elevator at one time. She said she's encountered times when people just don't care and come in, so she knows to just walk out and wait for the next one. She will be in it only with my brother. And so there's always, the most 2 people in the elevator, but she knows to plan ahead so that if somebody else does come in or doesn't sort of help her too, and help them by saying, all right, I respect that you need to be alone in this elevator to minimize risk, because that's a contained space, then she'll step out or she'll wait. So that's a really important thing in terms of smaller contained spaces.
That's really an important point. I know earlier this year you and I talked with senior apartment building managers. There's 97 senior buildings in the city of Cleveland, and so there's a lot of shared space in those buildings, right? There's elevators, there's the mail room, there's common areas in the laundry facility, and so really making sure that you've got, I think, the paper towels that you mentioned, but having the mask, maybe carrying a small size hand sanitizer as well. It's a new way of living, and getting advice from trusted entities is really important. I will tell you, Meryl, that we've seen an increase in people being scammed with people selling masks that never show up, sanitizer that never show up. And so I would just caution all viewers out there the importance of not responding to a solicitation by phone. If you didn't call a vendor looking for it, we know these items are in high demand, but my recommendation is to think about asking family members, neighbors, people you go and worship with, if they can secure some of those items for you at a box store and bring them to you versus ordering them from a site that you may not know or trust. So I do want to talk, though, a little bit more about facilities. So we've talked about apartment buildings, but I know there's a lot of attention paid to long-term care facilities. So whether it's a rehab facility, a nursing home, a hospital facility. First, I want to talk about, I know there's a lot of restrictions on who can visit. So if my loved one is in a nursing home, an assisted living facility, what advice would you give to the caregiver, whether it's the adult child or the spouse, about how to find out what's the latest regulations from the state about being able to visit? And then are there creative ways you've heard out there people are staying connected?
So Mary, I think this has been probably the most heart-wrenching, tragic part of COVID-19 is just how it has impacted older adults living in long-term care facilities, or congregant living facilities, as we call them. The outbreaks have been just astonishing. And I think sort of one of the things that you said earlier is we are a society where we interact a lot. We are close to one another a lot. You only really recognize until you miss it how much I miss hugging my friends and my family, right? How much shaking hands is part of our discourse, even kissing a cheek. I mean, all of that, without that, you know, you lose that human touch, which is why when we talk about social distancing, I try to just say distancing, because we need to remain social and supportive of one another. This is very hard emotionally on everyone. But going back to your question, so the state Ohio Department of Health and the governor's office, when I say the state, that's who I mean for the most part, have really been employing different orders which have been restrictions based on the number of cases and sort of how this virus has been moving through our state and through our community. So there might be a day where you are able to actually visit a loved one in a long-term care facility, and then they might shut that down if there is an outbreak or if we're seeing, you know, again, negative trends and people are not doing well. So you do need to keep up with that. We try, and I know that the State Department of Aging and the State Department of Health are trying to push out to all of the long-term care facilities and all of the congregant living facilities when there are more restrictions. I'll tell you, it is hard to keep up with everything changing all the time, so we recognize that. For months, they didn't allow any visitors in any nursing home or any long-term care facility or any rehab facility, and it was just, again, it was heartbreaking. Hospice was called in many times. The way that some family members were able to be with their loved one at the very, very end, it was, each case had to actually be determined if they could even enter the facility. So some of the things that, you know, we've tried and we've sort of learned from others that have been creative is some of the facilities have learned to bring the residents of the facility to a window with a screen so that they can have time with their loved ones outside on the first floor. Just recently, there have been some allowances that residents can be outside, so loved ones can come and see them outside for a bit. Of course, masks are required, hand washing beforehand, and even temperature testing has been done beforehand. So all of these are to minimize the risk of that virus entering that facility, because it spreads so quickly in some of these facilities, as we know that it's nobody's fault. It's just kind of how, you know, our structure has evolved, that that staff go in and out of rooms, that, you know, people were eating together, congregant living. There was somewhere there were 2 people, 4 people per room. And so in that space for a prolonged period of time, that virus could spread rather rapidly.
And I think knowing that the residents there are dealing with major health issues, right? And so we're taking the most serious actions to protect them and the staff serving them. I will share with you, one of the things we created in the Department of Aging during this time is a technology resource guide, because we've been seeing an increase of calls from people who want to know, how do I connect virtually? Could be with my mother or your mother. Both of us have older mothers who live alone and want to connect via technology. I'll share with you, my mother has never been on any device, never been connected to the internet. She's 85 years old. And during this time, we bought her a device that allows her to video call us. And it's been really of significance to her and to really for us to be able to see her and know that she's doing well. So this resource guide is 18 pages. It's not necessarily things that the city of Cleveland is responsible for, it's what our community as a whole is doing. So whether it's the Ashbury Senior Center and the computer classes they have, or ways to get affordable Wi-Fi, we know that that resource is in high demand now for people of all ages. But then also, where do you get hardware? Right? If I wanted to communicate to a loved one in a long-term care facility, where do I get a tablet? And is there ways that I can get them that are more affordable? So
Right. Well, I'll say, right, my mother's just a couple years older than yours, and she's had a little bit more experience with an iPhone. But I mean, I don't want to get emotional here, but just to see her, right, it's different than just talking on the phone and hearing a voice. And so it matters to her too. And she's learned to text, so she just it gives her something to do as well, and staying connected with so many people, and it is just so important. And you know, understanding that this disease has caused so much confusion. People have been more and more isolated, and our recommendation to stay home is again, it's sort of seems and sounds so punitive, but it's really to protect the entirety of the community, and yet you do need to have that emotional support. This can be incredibly devastating, sort of mentally and emotionally, and especially as we hear of, you know, deaths and people who've been severely impacted on ventilators, right? And just the scare of, are there going to be enough ventilators? Are there going to be enough and you know, I think the thing my mother was doing, at least initially, she's like, I turned the news off. You know, I just needed a break. And so, but the piece of it's easy to get sort of drawn into a scam or into sort of somebody selling you something, because again, it's just so much, and it's so much to comprehend, which is why I think, you know, making sure that the technology is there so you can sort of look eye to eye to your loved one and sort of talk through some of these things so you can all understand what this is about.
Well, let me talk a little bit about isolation, because that's something at the Department of Aging we are really concerned about, because many senior centers remain closed. Many recreation centers have restricted hours. Many of the places you might have gone for worship and connection with people are closed. And so keeping up with what are the other resources out there can be difficult. And I think that's where I want to make sure viewers know that you can call the Department of Aging, and we can let you know the latest on what the senior center's plan is. There are 24 of them in the city of Cleveland, and they all offer some virtual programming right now.
Great.
But you got to have the technology, right? But many of them are also doing telephone programs. So we do one of those every day in the Department of Aging, where you can get a wellness check. It's called Cleveland Care Calls. So if you don't have technology, but you have a phone, we want to help you stay connected. There's a great group called iConnect that's doing phone bingo. Oh. That you get the card mailed to you in the mail, and you do it over the phone, and then the prizes come in the mail later as well. So it feels like bingo from the safety and security of your own home. We also know there's virtual exercise programs, because people need to move. They need to keep active. They need to, for both their mental health, but also their physical health. And so this summer we'll be launching some Walk the Wards, some safe walking opportunities for older adults, and we want to invite viewers to find out when we'll be in your ward. But it's also an opportunity maybe to find a neighbor who you could walk with, right? And so outside, in a safe way, with the support of another person. I think many of us are looking for connections. And so while you may never have thought of calling the person that sits 2 rows ahead of you at your place of worship, they might be looking for connection too. And so the chance to use that directory and give them a call and say, first, maybe could we just connect by way of phone, but then maybe there's the chance to invite them to do a neighborhood walk. We do know that parks are open. Social distancing is still required, and masks when you're within 6 feet of people, but parks are still a place people can go to get fresh air and to move. And so we also know that getting connected to programs like Silver Sneakers, lots of seniors took exercise programs. So those are slowly we're seeing coming back, but we want to make sure seniors have access to know when and where they can go to those resources.
So Mary, I'll say a couple things. So being outdoors is the safest place, really, as well. Even though we're saying stay home, when we mean stay home, we mean don't go to a place where it's, you know, shopping or public, where you're around a whole bunch of other people in an indoor contained kind of space. Getting some exercise outdoors is so critical. One of the things that's promoted constantly is have a schedule. Try to wake up at the same time every day. Try to make sure you have at least a couple goals a day. Maybe that is meeting up with a buddy to do a walk around the block, or to do some, you know, lightweight, get 2 cans of soup and do some, you know, upper arm or upper exercises with the upper part of your body. And maybe making a couple calls in the middle of the day, eating on a regular basis, going to sleep at the same time, really can help give you back a purpose, something you can control. With this virus, there's so many things that we can't control. We can't see this little thing. We don't know where it is. It's kind of driving us all like to make some. It's making us change our entire lives. But it's very important to have a few things you can control. You were saying about the mail. This time to go back to writing letters and sending things in the mail. That's one thing I try to do to some of my friends in the limited amount of time that I have, because it's the most delightful thing to open up a mailbox and see a handwritten letter, and just something of encouragement. Doesn't have to say a whole lot. So things like that of giving folks. So that's structure. Not necessarily a technology thing, but yes, gives you structure, gives you some purpose, and you're really doing, it goes a long way. So those are just some other things that have been great recommendations.
Those are great ideas. I think I want to just also mention there's some special shopping hours for seniors at many stores. And so it's usually the first hour of the day when the store has been sanitized the night before, and reducing the number of people in there. So we know getting food, access to food is still critical. And so if you need a listing of those, we have them in the Department of Aging. Also, if you need access to food, that's a #1 call we're getting. And so whether it's home delivered meals, because of your concerns about going out, we invite viewers to call in and to the Department of Aging, and we can connect them to a resource that's available. The Greater Cleveland Food Bank has been doing an amazing job getting out.
My heart goes out to them. They are awesome. Yes.
Meat, dairy, produce. Dry goods, so that people, for both financial reasons and to be less in the stores. So we can connect you to those resources as well. Meryl, we could probably talk for hours, but I'm aware that I want to make sure that viewers have the right numbers to call. So for the Department of Aging, it's 216-664-2833. You're going to get a live person who answers it. We are open 5 days a week. And out in the community, many people see us out cutting grass and helping people sign up for benefits, but we're also responding to needs specifically around COVID. So that number is really critical at the city, 664-2833 for the Department of Aging. For the Health Department, what's the best number to reach?
Sure, so you can call 664-2300, that's 216-664-2300. We also have a website that is www.clevelandhealth.org. Again, that's clevelandhealth.org. We update that almost daily on our website. If you're able to reach it, we have also a dashboard that is updated every single day of COVID cases throughout the city. It's more information around COVID, but it gives you essentially a daily snapshot of where we are. And it might be helpful for the viewing audience to see that and see what the health department is working on, and really how many cases in our community and why we take this so seriously. And it's a struggle sometimes for people to take it seriously until they realize what has happened to somebody they know. If I could say just a couple other things for folks to consider. So we've had this question a lot is, can I get it from a family member? If I live in a house with somebody else, can I get it from a family member? So if you live in a house and the family unit never leaves that house or and stays together the entire time, you're generally immune then to one another, and the risk is very, very low. If somebody from that household goes to work or goes to perhaps a bar or a restaurant, or perhaps is not complying with wearing a mask, or might be engaging in an activity where you're very close to other people, you might be yelling, screaming, singing, enjoying yourself, whatever it is, and you're putting yourself at risk, you could possibly be bringing that home as well. And so for older adults where there are different generations living in a household, it's very important to understand that you're putting everybody at risk when you come home from anything that you are doing. Which is why, again, it's so important to take all of these precautions to make sure that that mask is worn appropriately, to make sure that you're washing your hands. If you feel that you might have been somewhere where there could have been a possible exposure, it's very important to take all those clothes and wash them immediately and take a shower, wash your hair. Washing your body with soap is just as important as washing your hands. So those kinds of things are really important, and we encourage that for folks who live in multi-generation households. If you're going to have a barbecue in the backyard, or if you're going to invite others over, really, again, take all these precautions into consideration. Set the chairs up before they arrive so that everybody is within the 6 feet of one another.
Let's show that again, because that's really, it's...
Measure something. Find something that is 6 feet.
That's how far we're sitting apart, and this feels unusual. Right? This is hard. Normally we'd sit closer together, so it's all new
And
realities.
I often I'll touch the person I'm talking to because I like to do that. It really, your arms should not even be able to touch. So if you put your arm out like this, Mary, you should still make sure there's at least a good foot in between. So it's another way of sort of thinking about
So as you're thinking of having people over, maybe a neighbor on your front porch, because isolation does have health consequences, right? They say it's the equivalent of smoking 15 cigarettes a day, being isolated. It can be. And so thinking about where could you position people for that barbecue you mentioned, or that...
Just like I say to my mom all the time, is just have a plan. Think about this in two ways, is that you don't have the disease and you don't want to get it from anybody else. So make sure you're doing everything to protect yourself. At the same time, think about yourself having it and you don't want to give it to anybody else. So what do I need to do? If I'm in the elevator with somebody, I might face the wall so that I am not looking at that person. I'm not going to speak while I'm in that elevator so that there are minimum amount of droplets that are coming out of my person when I'm breathing. But you know, we make sure that the chairs are, again, far enough away from each other that it's a safe distance. I don't have to move things around when somebody comes over. So it's already predetermined. That plan is already made, how you're going to get from here to there. But it's so important to pay attention to these things and to learn from trusted resources. And there are, as always, Mary, you know better than any, right, that scams are amidst us on every level. And so it's just, if you don't need to question these trusted sources of information. So don't confuse yourself by going down roads of places that are not and are questionable. And there are just these small tips that really can help protect you and protect your community and protect your family.
And we'll put up on the screen some important other websites and phone numbers for like the Ohio Department of Health and CDC, these other trusted resources that you can go to. And I think a message I really want to end with is that the Department of Aging, the Department of Public Health are open. People can call us for questions. We want to be as helpful as we can and get out the right information and create a healthy Cleveland.
Right, and we're going to get through this.
We are,
We're going to get
right.
through this together. We care about one another. This is the time to really show that empathy to one another. And just like I so appreciate you as my colleague, we're all going to get through this together.
great
I have so much
advice.
hope.
So we'll end with this. Thank you for joining this special segment of Healthy Cleveland and Age-Friendly Cleveland. Thank you.